most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Time to work, Brad.
That's
Today, we're going
right.
to talk about the most important exercises to help pinched nerve and neck pain fast relief. This is an updated video, by the way. We did this one before.
Yeah, but now we've got a nice new stretch in there. We're going to review it, look at it from a different look, a little angle, the angle I'm talking about.
Yeah, the old one, by the way, we got interrupted by some nursing home staff.
Yeah,
they came in and started talking to us.
They were rude, and we had to reprimand them.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away.
Right.
This week, we're giving away one of our... You can also go to Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, TikTok if you want a 60-second version of our program. We also have Bob and Brad Clubs, which is 60 seconds.
Yeah, another short little clip.
All right.
And we got the podcast.
And we
Bob.
got the podcast.
My
God, we're
up
everywhere.
And running. You know, there's something I want to mention that there's a couple complaints about our sign is getting beat up a little bit. But, you know, we like to get every last bit out of it.
That's right.
So anyways, neck, pinched nerve. We're talking about pinched nerve in the neck associated with neck pain. But oftentimes, as a result of that pinched nerve, you can get referred pain into the shoulder blade, which is really common, down the shoulder, into the arm, and all the way up to the fingers, actually.
And if it's into the fingers, it generally means you got a pinched nerve somewhere.
Right, exactly. So what we need to do is kind of show you how this works and why the nerve gets pinched. So we're going to use our friend Sam and Gumby as his sidekick. We're going to look, what I do, I have a nerve put in here, and we're going at a low level because typically a pinched nerve happens at C6 or C7, and that's
this bone or this bone.
Those cervical bones, and then the nerves. Here's the little nerves coming out here, and
they're coming out of the foramen or the holes, and they can get pinched there,
right?
From bony overgrowth,
right?
Or they can get pinched from the disc itself,
right? So the nerves here are cut off. So I put a extended one because this is the route that the nerves get down. Actually, more than just one come off. They come out, I believe there's 3 or 4 that come together and they form the brachial plexus. But the route is the same underneath the clavicle. It kind of goes through the axillary.
Underneath the collarbone.
Yep, under the
goes
collarbone.
Through your armpit.
Yep, there. And then it goes down. And it starts to branch off down into the arm. So what we're going to do is we need to unpinch it. Probably most of the time, the nerve is pinched up in the neck, in the cervical column. It could possibly be somewhere else, possibly in the elbow. But we're looking at this area because the majority of the time, that's where it is. And you'll know just by some movement of your neck, typically. So, any other questions with Sam?
No, I was just going to say, Brad, so the first thing you really need to do is we need to stop the cause. Because if you do these exercises and you haven't stopped what's causing it, it's just going to keep getting bad. It's going to keep getting worse. So one of the causes?
Causes of what?
Well, one of the causes is a head forward posture.
I know. I had another thought, though, Bob.
Oh, all right.
I just wanted to say one way you can confirm it's in the low neck, and this is what I do with most of my patients, is I have them sit up good and tall and straight in their chair. I have them get their head over their ears with a mild chin tuck. And then I say, can you look back like this really far? And if they go back like that and it hurts, I'm thinking, and I don't know what the percentage is, but a high percentage, it's definitely
involved in the neck.
In the neck.
Yeah.
We work the neck, we free the neck up, things get better, the neck feels better, down the arm goes better. That's the majority of cases in my experience.
Yeah, really, if we treat the neck and it gets better, obviously it was in the neck.
Right.
So
exactly. So yeah, posture. The 3 big things in our society that causes poor head and neck posture, which can create a pinched nerve, is looking at your cell phone.
Yep. Looking down like this.
Yep.
And moving the head forward.
Yep.
Yep.
Driving a car, same
Yeah.
thing. People that have their head over their steering wheel. I'm exaggerating a little bit, but you know what I mean.
Well, one thing, if they have the seat leaning back too far,
Yep.
it causes you to move your head forward like
Right,
that. So that's why we want the
exactly.
seat upright, so you're in good posture.
Exactly. Sitting at a desk,
Yeah.
computers, a
Yeah.
little laptop or the
Especially the laptops, because
Yes.
you're going to go down like this.
Yep.
And we got to get those screens raised up.
Yeah, you got to get the screens raised up, get your chair positioned properly. We've got videos on that as well. We're not going to go into detail, but posture is big. So adjust your posture. Make sure you're sitting up tall, head over your ears, if you will.
We like chin tucks.
Yep.
I mean, that'll be part of the exercise program later.
As a matter of fact, we throw it in right now because
Yep.
then we're going to show exercises while you're sitting at your desk in your car.
It's a great correction exercise.
Do chin tucks.
Yeah.
Chin goes in towards your throat, not down like this, but
Or not up.
right.
It's a reminder to you, not only does it do the job of moving your head back, but it's a
Yep.
reminder where your head should be positioned.
Right. I've had a
So-
number of patients, I say, can you do a chin tuck? And they got the pinched nerve.
Yeah.
And even that will start to irritate it. And it's like, so then we have to work into that gently, but we work with,
Or
you know,
even do it lying down on your back.
Right.
Just
Yeah.
work on it
Yep.
with a towel behind your head. So,
exactly. So
Okay.
we're going to start with the chin tucks and good posture. Another exercise so you know you've got good posture. Can you swing over this way, Mike? Is we use our friend, the wall.
yeah.
And make sure you put your butt up against the wall. This is the way I teach it. And then your shoulder blades. And then if you can get your shoulders back like this as opposed to forward. So we'll get the shoulders back. Now we've got good posture. But then the last critical thing is, can you get your head to touch the wall there with a little bit of a chin tuck? And that might be difficult at first with this pinched nerve, but we're going to show you a trick to get out of it. And then from there, do the famous W's. Now you can do this without the wall, but the wall lets you know for sure if you've got that good posture because you touch your elbows in your hands and you can work wall angels up and down. It depends on how tight your shoulders are and just do some repetitions like this, 5 to 10 repetitions and do that throughout the day.
And why we do wall angels and why we do this next one is because if you are rounded out in this position right up here in the upper back, that if you're rounded out there, there's no way you can straighten your neck out.
Yep.
I mean, it's going to affect your neck. So we got to get that all stretched out too.
Right.
The wall angels do it. A foam roller does it. Did you want to go lengthwise or do you want to go roll it?
Well, we could do both. If they got a roller, they might as well do both.
So the one is you can just work on the upper back. And a lot of times if you fold your arms, you can really get between the shoulder blades as well. And you can just work on that area and stretch it out.
If you're doing a roller, don't do it on your bed. You can see on the soft cushion it doesn't work well. You know, on the floor works a lot better. With the exception of this next one, you could do this one
I'm going to
on
let
the
you
bed.
do this one, Brad,
Sure.
because I never get on that thing well.
Yeah. So then you turn, if you got a 3-foot foam roller, you turn it this way, right down your spine, especially if you got the one that the lower density, it's more comfortable. And then you get your chin. Now this is just like doing a chin tuck. As a matter of fact, you can do baby chin tucks while you're just relaxing. You're going to relax for 5 or 10 minutes.
And straighten out your entire posture here. It's straightening out that upper back, lower back, and it's stretching out your pecs.
Exactly.
So it's an easy one to do in a relaxed position. Your head might not be able to get all the way back to start off. You might have to use a roll towel or something. But
if it doesn't go back, you could put a rolled towel or folded up towel. They make this device as well. But you want to get rid of that and get your head down. That's going to help free up that pinched nerve as well.
One last thing, Brad, just real
sure.
quickly. It works for my patients a lot. Is if you're having pain down, let's say the right arm, just whenever possible, put your arm up on a pillow. Because if the arm is being hung like this, it's going to pull your shoulder forward. It's going to put more stress on that nerve.
Right.
This is just a great way to start getting good posture and taking stress off the nerve.
Sure. Should we show that the new exercise
Sure.
by Stuart McGill?
Sure. This is we're just strengthening the neck without putting stress on it. So you're going to be in good posture. I want you to put your tongue behind your teeth, in front of your teeth, right?
Okay.
And then you're going to squeeze and tighten up the muscles here in the neck.
In the front of the neck.
Yep, in the front of the neck. Then you're gonna take your hands, your two fists here, and you're gonna. If I wasn't holding it, I would actually be pushing the neck up.
Okay, so it's like an isometric.
Yeah, it's isometric. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we could do 10 of those. 2, 3, 4, 5, 6, 7, 8, 9, 10. What it does, it strengthens the correct muscles without putting shear force on the bones. So it's a comfortable way to strengthen, is what I'm trying to say. And
that should help posture, which
yeah,
is going to take pressure off that nerve.
It's strengthening the deep flexors, which get weak because you're strengthening the extensions when you have
with
that
bad posture. And now the other exercise. What happened to all my
here? Sorry, Brad.
Oh, no wonder. You can take a towel roll, and what we're going to do. I got a towel rolled up. This is how a lot of times I have patients start. As I mentioned earlier in the video, if you can't go back like this and it hurts.
This is a McKenzie exercise, by the way. Robin McKenzie developed it.
You take a towel roll and go back in your chair, good posture, and gently go back like this. And oftentimes I say, oh, that support there feels better and I can go back farther. And then you gently work that, 5, maybe 10 repetitions, then you got to take a break and then come back at it in an hour or so. If your arm in your hand is feeling better, it's a really good sign. If you start to do this and it starts to hurt worse down the arm, that means you're pinching the nerve a little bit harder, and then you have to go to the next option.
Now, Brad was saying that the towel helps better than no towel.
Right.
I mean, basically, if you just try these, if you can do these without the towel, do them with the towel, out the towel.
Yep. I've had people have success just by putting their hands back with your fingers down.
Give it some support.
Low on the neck.
Yep.
And then you don't even have to use that towel, and you get similar results. And that depends on the situation and the individual. You can use which can work well is just the edge of a towel. So instead of a thick towel, we get more specific.
The selvage.
Yep, the edge of the towel or the selvage. I'm going to get it low on the neck and kind of adjust it.
And yeah, that's the advantage of using the selvage, is you can really get focused in on one area of the spine.
Right where that nerve is. And we'll do the same thing, and we can roll up and pull up.
Pull up towards the eyes. If you want to.
I've had people do it this way and this way, and whichever way works better, feels better, it gives you more range.
Often I might recommend is grabbing it with one hand. Like if you have a painful arm, grab with a non-painful arm and just do one hand. Because it's just going to be more comfortable.
Yeah, because with the injured, the arm that's sore, it can even irritate it, so you can relax it, put a pillow.
Now, the thing about these, you can do these throughout the day. You don't just do them once and say, hey, I'm done. I did what Bob and Brad said. No, you do it like every hour if you can. And that's how you're going to get some relief. You're going to get the benefit of it.
As long as the symptoms are getting better out of the arm or moving from the shoulder up to the neck. And you don't have to do it forever. You're only going to do that for, usually I've had patients do that within a couple of days. And
they start seeing some relief.
Right.
And then they're motivated.
Right. And then the maintenance exercise is usually the posture exercises and chin tucks.
Yeah. By the way, Brad, you could also use the strap.
Yeah, if you have one of these work really well.
Those work really well.
Particularly if you have arthritic hands or you don't have good grip, because you can go like this in the loops.
But they can hit right on a spot.
Yeah, you can get specific. And then again, I'm not gripping, but I'm using my hands. And it does really work well. And of course, you can use these for a lot of other stretches and whatnot, a stretch out strap. They're not very expensive either, but I wouldn't buy it just for this.
If
you got it laying around.
Give the towel a try. So, thanks for watching, folks.
Good luck.